Have you ever considered how a small misstep before a blood test could throw off your results and potentially jeopardize your health? For older adults, inaccurate test results aren't just inconvenient, they can lead to serious consequences. Everyday habits you might not even notice can quietly distort your blood work, making your health appear better or worse than it truly is. This can mislead your doctor into making decisions based on faulty data. Drawing from years of insights shared by seasoned cardiologists, I've learned that avoiding a few common mistakes before a blood test can be the difference between a clear diagnosis and months of unnecessary stress or treatment. This isn't about gaming the system to get perfect results, it's about ensuring your doctor gets an accurate picture of your heart, blood, and overall health to guide the best decisions for you. In this video, we'll cover 5 things you should absolutely avoid before a blood test to safeguard your health and avoid complications. Stick around until the end, because the final one is rarely discussed but can significantly impact your results. Number 1. Drinking coffee or tea before your test. One of the most frequent mistakes is sipping your morning coffee or tea before a blood test, assuming it's harmless. After all, it's just a drink, right? The issue is that caffeine and other compounds in coffee and tea can cause temporary changes in your body. They can elevate your blood pressure, increase your heart rate, and even shift hormone levels. More critically, they can skew your blood sugar and cholesterol readings, even if you drink them black. These small changes can be enough to raise red flags for your doctor when nothing is actually wrong. Take Susan, a 72-year-old who went for her annual checkup. She had her usual black coffee before her appointment, thinking it wouldn't matter. Her results showed elevated blood sugar and a slightly higher heart rate, prompting her doctor to order follow-up tests. Susan spent weeks worrying about diabetes, only to find out, after retesting without coffee, that her numbers were normal. That stress could have been avoided. Caffeine stimulates your adrenal glands, releasing stress hormones like cortisol, which can alter metabolism and affect fasting-sensitive tests. When instructions say nothing but water, they mean it. For older adults with conditions monitored through regular blood work, precision is vital. Stick to plain water before your test. It's a small step that can prevent big misunderstandings about your health. Number 2. Taking medications without checking with your doctor. Many seniors have a morning routine of taking their pills with a glass of water, often before breakfast. It's second nature after years of consistency. But taking medications before a blood test, especially one requiring fasting or checking organ function, can skew results. Certain medications like blood pressure drugs, diuretics, or even supplements can temporarily affect electrolyte levels, blood sugar, or other key markers. This might hide a real issue or make a healthy reading look problematic. Consider James, a 76-year-old on a diuretic for heart health. He took his usual dose before a fasting blood test, and his results showed low sodium levels and poor kidney function. This led to extra tests and anxiety until his doctor realized the diuretic had distorted the results. A retest, with proper timing, showed everything was fine. The key is to consult your doctor or pharmacist ahead of time about which medications to take or skip before the test. Bring a list of everything you take, including vitamins and over-the-counter supplements, to get clear guidance. Accurate results are like a roadmap for your health. Don't let a routine pill blur the view. If you're finding this helpful, please comment number 2 below to let me know you're with me. And if you haven't subscribed, consider doing so and hitting the bell to stay updated. Your support keeps us creating content to empower you. Number 3. eating before a fasting blood test. A surprising number of people misunderstand fasting and think a small snack or light breakfast is okay. But if your test requires fasting, any food, even a piece of fruit or toast, can throw off critical markers like glucose, cholesterol, or triglycerides. These numbers are used to assess risks for heart disease, diabetes, and more, so accuracy matters. I recall a patient, Margaret, 70, who ate a yogurt and banana before her fasting blood test, thinking it was light enough. Her triglycerides came back high, and her blood sugar was elevated, prompting her doctor to consider medication. After admitting to her light breakfast, she retested while properly fasting, and her results were normal. Food raises blood levels of glucose and fats for hours, distorting your baseline. For seniors, whose doctors track subtle changes over time, this can lead to misdiagnosis. Fasting means no food, only water, for 8-12 hours as directed. It's not about deprivation, it's about ensuring your results reflect your true health, avoiding unnecessary worry or treatment. Number 4. Exercising vigorously before the test. Many older adults take pride in staying active, but hitting the gym or going for a long walk right before a blood test can backfire. Intense exercise, like jogging, cycling, or weightlifting, releases enzymes and byproducts into your bloodstream, such as creatine kinase, which can mimic signs of heart or muscle issues. It can also alter blood sugar and electrolytes, giving a false picture of your health. I once spoke with David, a 69-year-old who loved his morning bike rides. Before his blood test, he cycled for an hour, thinking it would show his fitness. His results showed elevated enzyme levels, raising concerns about heart damage. After a week of worry and more tests, his doctor realized the exercise had skewed the results. For accurate blood work, skip strenuous activity before your test. Light stretching is fine, but save the workout for afterward. This small pause ensures your results reflect your everyday health, not a temporary post-exercise spike. If this is resonating with you, comment number 4 below. And if you haven't subscribed, please do, and turn on notifications to catch our next video. Number 5. Drinking alcohol the night before. A glass of wine or beer the evening before your test might seem harmless, but even moderate alcohol can affect your results. It can raise liver enzymes, triglycerides, and blood sugar, which are critical for assessing heart and liver health. Elevated liver enzymes, for instance, might suggest a problem when it's just your body processing alcohol. Take John, a 73-year-old who enjoyed a couple of glasses of wine at a dinner party the night before his blood test. His liver enzymes were high, and his triglycerides were off, prompting concerns about liver issues. After weeks of stress and additional tests, a retest without alcohol showed normal results. Alcohol can also dehydrate you, making blood draws harder and less comfortable. For the most accurate results, avoid alcohol for at least 24 hours before your test. This ensures your doctor sees your true health, not a temporary distortion. As we age, protecting our health means being mindful, especially before routine blood tests. These tests aren't just numbers, they're a window into how your heart, liver, and kidneys are functioning. By avoiding coffee, unauthorized medications, food, intense exercise, or alcohol before your test, you ensure those numbers tell the truth. I've seen too many people face unnecessary stress from skewed results due to simple oversights. The good news? These mistakes are easy to avoid with a little planning. Think of your blood test as a chance to give your doctor the clearest view of your health. A few small adjustments can save you from confusion, extra tests, or misguided treatments. We'd love to hear from you. Comment below with one thing you learned today and how you'll apply it. Your feedback inspires us. If you found this valuable, please like, subscribe, and share. Thank you for watching, and we'll see you in the next video.